أهلا بكم في تلفزيون كارديو أليكس.
And with us Dr. Tyrone J.Collins, intervention cardiologist from the USA. Hello, doctor.
Thank you. Glad to be here.
What do you think about CardioAlex2017, and is it meeting your expectation?
I just arrived. The meeting is large as expected. I've been coming to CardioAlex for a number of years. I was actually at the initial CardioAlex meeting, and the meeting always exceeds my expectations.
Okay. What are you going to present this year?
This year I'll be presenting several topics. One will be in the coronary arena, talking about radial access, which is gaining more support in the U.S. The other will be about left main coronary artery stenting, which is a somewhat controversial topic. And then I have a topic on peripheral thrombolysis, which is a procedure that's been around for a number of years, but not many cardiologists are using it, and they should be using it.
What is new in the field of intervention in 2017?
Yeah, I think the new procedures in interventional cardiology in 2017 are more aggressive or expansion of coronary stenting in patients that in the past were referred for bypass surgery or did not have options for what we would call revascularization. I think the other new topics or procedures are stents with different designs, including the bioreabsorbable and bioabsorbable stents, and the expansion of what we call TAVR, or treating valve conditions without doing traditional open heart surgery.
And what is your opinion regarding the new bioabsorbable stents?
Yeah, I think the new bioabsorbable stents are a step toward the future. I'm not sure what patient population will best benefit from the bioabsorbable stents. The technology is quite seductive, but it comes at a price, and is that price worth it for the majority of patients? I don't know yet exactly what type of coronary lesion we should be treating with the bioabsorbable stents. I don't think we've defined that population yet.
Okay. When to evaluate intermediate lesions using IVUS or FFR?
Yeah. In the past, we would use a visual assessment to decide or to determine which coronary artery should be treated. I think with the emphasis on cost and the emphasis on quality, we have to be sure that the lesions that we treat are actually lesions that are causing problems for the patient. And that's where the FFR and IFR come in. So for lesions that are what we would call intermediate, say in the 60 to 70% range, where we're not quite sure that lesion is a ischemia-producing lesion, and those are the types of lesions that should be interrogated with one of those procedures.
Okay. What would you like to see in CardioAlex 2018?
I'd like to see that some of the topics that have been discussed in the past, including last year, are more entwined in the practice of medicine here in Egypt this year. I'd like to see what's happening on the valve arena in CardioAlex from operators from different parts of the world.
Okay. At the end, I would like you to say a word to the world to come to Egypt, and that Egypt is safe and is it meeting your expectations?
Yeah, so I've been coming to Egypt since 1989, and I've always enjoyed the time that I've spent here. I have some very good or close friends here. I always enjoy the opportunity to come back to Egypt. I feel very safe I would encourage anyone that has an interest in antiquities or traveling to the Middle East to certainly consider coming to Egypt as their first choice.
Okay, thank you a lot, Doctor, and welcome to Egypt.
Thank you.
I hope that you enjoy and see you next year. Bye-bye.